Assalamualaikum and good day everyone. We are group 4 and today we will be presenting on the topic extended spectrum penicillin. First of all, I will explain what extended spectrum penicillin is. So, extended spectrum penicillins are broad spectrum antibiotics that are effective against both gram-positive and gram-negative bacteria. They are especially useful against gram-negative organisms such as E. coli, Proteus, and Pseudomonas. In clinical practice, especially in critical care settings, these drugs are often used either alone or in combination with beta-lactamase inhibitors. This combination helps to extend the antimicrobial spectrum and overcome bacterial resistance. Extended spectrum penicillins are a group of beta-lactam antibiotics that work by inhibiting bacterial cell wall synthesis. They bind to penicillin binding protein and disrupt peptidoglycan formation, which eventually leads to bacterial cell death. These antibiotics are commonly used to treat various infections such as skin infection, lower respiratory tract infection, urinary tract infection, and intra-abdominal infection. Examples of drug in class include carbonicillin and mesilocillin sodium. Carbonicillin is mainly effective against gram-negative bacteria, especially Pseudomonas aeruginosa, while mesilocillin has broader spectrum and can treat both gram-positive and gram-negative infections. However, extended spectrum penicillins may cause side effects such as gastrointestinal upset, allergic reaction, and potential drug interaction.
Pharmacokinetic. Pharmacokinetic is the study of how the body processes a drug over time. It includes four main stages: absorption, distribution, metabolism, and excretion. Absorption. Carboxypenicillin is poorly absorbed when taken orally because it is unstable in stomach acid and poorly absorbed in the intestine. Distribution. Once in the bloodstream, the drug spreads widely into extracellular fluid and tissue. It can reach synovial, ascitic, and amniotic fluid, but it does not penetrate the cerebrospinal fluid well, so it is less effective for brain infection. Metabolism. The drug undergoes minimal metabolism in the liver, meaning it rarely interacts with liver enzyme. Most of drugs stay unchanged in the blood, reduce the risk of drug interaction. And last, elimination. Carboxypenicillin is mainly removed from the body through the kidney, with most of it excreted unchanged in urine. Some of the drug may also be excreted in bile, contributing to its removal. For acylrhodopenicidine, in other words, absorption directly affects plasma level. If a drug is absorbed less efficiently or spread widely into tissue, the peak concentration in the blood will be lower, even if the total dose is the same. Distribution, the half-life and volume of distribution are generally similar. Both can increase with higher dose, meaning the drug may stay longer in the body and spread more widely when larger doses are given. For metabolism, the drug undergoes minimal metabolism in the liver, meaning it rarely interacts with liver enzyme. Most of the drugs stay unchanged in the blood, reducing the risk of drug interaction. And last, elimination. Like carboxypenicillin, acylrhodopenicidine are mainly excreted by the kidney, with most of the drug appear unchanged in the urine. Some drug can also be found in bile, contributing to its removal from the body.
Let's look into the pharmacodynamic of class beta-lactam antibiotic. Extended spectrum penicillin will inhibit the bacterial cell wall synthesis. We all know gram-negative bacteria has thin peptidoglycan layer between membrane, and extended spectrum penicillin will block it. They will bind to the penicillin binding protein and block formation processing of peptidoglycan chain, leading to sepals. Site of action. Penicillin binding protein is located on the cell membrane. It is a DD transpeptidase which catalyzes final step of cross-linking of peptidoglycan chain. Beta-lactam antibiotic mimic the natural substrate and bind irreversibly to active site of penicillin binding proteins. Now let's look at the receptor. The beta-lactam's antibiotic and penicillin binding proteins function as irreversible enzyme antagonists, forming covalent bond with active serine site of penicillin binding proteins. The dose response. The dose needed to function are moderately potent, which lower doses may be ineffective if drug level fall below minimum inhibitory concentration (MIC). It has high efficacy when adequate plasma concentration are maintained. Let's look into the therapeutic and toxic effect. The therapeutic side, broader gram-negative coverage, which has high spectrum of activity, including Pseudomonas aeruginosa, Klebsiella species. However, it also has toxic effects, which are allergy, diarrhea, hematologic disorder, sodium load, and interstitial nephritis. The duration of action. It has short half-life, which around 1 hour before they are excreted quickly in rapid renal clearance.
Carbonicillin is an extended spectrum penicillin antibiotic. It is used to treat bacterial infection, especially urinary tract infection (UTI), such as bladder and prostate infection. Carbonicillin works by damaging the bacterial cell wall, which causes the bacteria to die. It is effective only against bacterial infection and does not treat viral infection like the common cold or flu. The dose depends on the patient's age, weight, and type of infection, and it can be given orally or by injection. To be effective, it should be taken exactly as prescribed and complete fully. Carbonicillin may cause some side effects such as nausea, vomiting, stomach pain, headache, and vaginal infection. These effects are usually mild. However, serious adverse reactions can occur although they are rare. These include severe allergic reaction, severe diarrhea, blood problems, kidney or electrolyte disturbance, and confusions, or especially with high doses. Carbonicillin should not be used in patients who are allergic to penicillin. Patients should always inform the doctors about any allergy or medical condition before using their medication. Mesilocillin sodium is an extended spectrum penicillin antibiotic. It is used to treat serious bacterial infection, including infection of the urinary tract, respiratory tract, abdomen, skin, and blood. Mesilocillin sodium works by inhibiting bacterial cell wall synthesis, which causes the bacteria to die. It is effective against a wide range of the bacteria, including E. coli, Klebsiella, Pseudomonas, and anaerobic bacteria. The drug is usually given by intravenous or intramuscular injection, and the dose depends on the severity of infection, age, and body weight. It should be used only as prescribed by the healthcare professional. Common side effects include diarrhea, nausea, vomiting, stomach pain, and gas. Some people may have allergic reaction such as rash, itches, or heaves. Pain or swelling may occur at the injection site. Serious side effects are rare but can include bleeding problems, low blood cell, liver, or kidney problems. For contraindication, do not use meslazine sodium if the patient is allergic to penicillin. Use with caution in patients with kidney disease, bleeding problems, or during pregnancy and breastfeeding.
First is the right patient. Nurses must always confirm the patient's identity using proper identification to avoid medication errors. Next is the right drug, ensuring the correct medication is given as prescribed. The right dose is important to make sure the patient receives the correct amount for safe and effective treatment. The right time means medication should be given at the correct scheduled time and properly recorded. In addition, patients have the right education where they can inform about the medication, its purpose, and side effects. Patients also have the right to refuse, and this decision must be respected and documented. Lastly, the right expired date of drug ensure only valid, non-expired medication are administered. Moving on, the right route ensure the medication is administered through the right route such as oral or intravenous. The right assessment involves checking the patient's allergy, history, and conditions before giving medication. The right documentation requires accurate recording after administration to prevent errors.
In general, patients should follow the prescribed dosage strictly, complete the full course of antibiotics, and avoid skipping dose. Patients should monitor for signs of allergic reaction such as rash, itching, swelling, or difficulty breathing and report this symptom immediately. If the drug is given intravenously, they should report any pain, redness, or swelling at the injection site. In terms of diet, patients are encouraged to maintain a balanced diet and drink plenty of water to stay hydrated. If stomach upset occurs, light and easily digestible foods are recommended. Common side effects include nausea, vomiting, diarrhea, headache, and injection site discomfort. However, severe or persistent diarrhea, usually bleeding, or sign of kidney problems require intermediate medical attention.